Hey, and welcome to the second part of Chapter 1, The Human Body in Orientation. The second part of this chapter will go through more of the division of the body and ways that we can reference body parts and divide things up into certain segments or cavities. And we'll start by talking about anatomical position. This sort of provides a framework for the body, and this position involves a person just standing, looking forward, facing forward, or anteriorly. Their palms are facing anteriorly, and their feet are in kind of a neutral position, slightly apart. We use this position as a framework, and we will apply to it what are called directional terms and also regional terms. Uh, so the way that I explain anatomical position is like this. That gives us kind of a map. And then the directional terms would be like how we use east, west, north, south on a map. All right, we're going to use them, and that way we can all have the same language as healthcare providers, so that me as a physical therapist or you as a nurse or any other healthcare provider can communicate and describe exactly where maybe a patient's wound is. Maybe they've had an incision. Maybe we see a skin marking that we want to refer them to a physician, and we want to use these terms. So I'll go through a few more examples in just a little bit. But these directional terms, to define them, describe a body structure in relation to another body structure, and they help us to pinpoint specific body points, landmarks, lesions, whatever. Okay, so we use it in reference to anatomical position. All right, it's also important to note that right and left are not your right and left, but the patient's right and their left. And so if they're in anatomical position, similar to this chart. If you're facing them, your right is their left, your left is their right. And there's a crazy amount of surgeries done each year on the wrong body part or body side. So left and right are very important. Okay, so here's some directional terms, and we'll just start at the top. Superior means the structure is up toward the top, up closer to the top of the head. Inferior means that it's farther away, closer to the bottom of the feet. Anterior is also known as ventral. They're synonyms. It means toward the front of the body. Posterior or dorsal means towards the back side of the body. Medial involves an imaginary line down the middle of the body. And we use medial to describe anything toward that midline. Lateral means that the body part or the wound or whatever it is farther away from midline. Superficial means close to the surface. Deep is underneath or farther from the surface. And proximal and distal are only used with limbs like arms and legs. These reference the point of origin of the limb, like where does your arm start and where does your leg come off of the trunk. So proximal means closer to the point of origin. Distal means farther from the point of origin. And there's a table in your text that goes through each of these and kind of gives you some visual of what they look like. I have also posted some practice quiz games for these, so hopefully that will help. Now, how do we use them, in the body and describing something, where a wound is or whatever? Let's go through that. Well, when you start learning these terms, a lot of textbooks, a lot of your practice questions and things like that will ask you to compare body parts. So they'll say, okay, where is the umbilicus, the belly button area, compared to your antecubital area, the front of your elbow, right? And so if we say the umbilicus is blank to the elbow, okay, well, it's closer to the midline over here. So how can we say closer to the midline? Medial, right? The umbilicus is medial to the elbow. All right. Or what if we compare the belly button to the vertebral column, the spinal column in the back? It's closer to the front, right? And so how can we say closer to the front? Anterior. So that's one way that we can kind of describe and use directional terms. Now, when you get out in practice, I don't know how much you'll do that, but you may have a patient. I'll give you an example. My daughter had a mole on her leg, and she's very young, and so I took her to the doctor, and I was like, I just don't know, it's kind of questionable. I had some changes going on, so we went to the dermatologist, and they were like, where is it, when I called, and I said, well, it's on her left leg. I said it's the lower leg, or distal left lower extremity. It's anterior, so it's on the front. And I said it's medial on the leg, right? So they knew exactly where to kind of look for it when we got into the examining room. So that's just an example of how you might use it, maybe for locating an incision, or where a patient's pain is, or whatever. And so there's lots of practice exercises for this. So there's a couple of other terms that we can use to narrow specific areas too. We can divide regions up, including the big divisions, axial and appendicular. And this is a way that you'll really use the skeleton, and kind of divide the skeleton up into sections, and muscles into sections. You'll see your textbook, and a lot of lab manuals do this. They'll say, okay, let's start with the axial parts, which involves anything along the long axis of the body, like the head or skull, the neck, the trunk, the ribs, the vertebral column. And then the appendicular division involves the limbs, the arms and legs. All right, but we can also pinpoint more specific areas on the axial or appendicular body with regional terms. And so regional terms, there's a million. We won't go through every single one, but I've put some games up to kind of help you learn these, and identify where they are. But they can really help us be specific. So earlier I talked about the example of my daughter. I could have just said, okay, it's on the left crural region, Crural. I can't say that word. It's right here. That's what that means, is shin. Okay. If you've got a patient and they had an inguinal issue going on, that's in the groin. Axillary, armpit, right? And so we can kind of really narrow things down as far as the regional terms. And that's just another way to pinpoint an exact location. So if you've got a patient coming into the ER and they've had a gunshot wound, and you say, well, where is it? Oh, it's on their leg. Well, where on their leg? Their femoral region, right? So now we know it's in the thigh. We're worried about a certain artery, right? And so we can narrow that down. Okay, moving on. Another way to divide things up is by planes. Planes are three major planes that sort of involve this imaginary plane of glass, so to speak, through the body, and they divide it into certain sections. And so the three main planes are sagittal, frontal, and the transverse plane. So the sagittal plane divides the body into left and right sections. Now, I'll show you a picture of this. If we were to take it right down the midline, that's a mid-sagittal plane. But if it was slightly lateral, left or right, it's a parasagittal plane. But it provides us with unique views. So why do we use planes? Where do these come in handy? They come in really handy with imaging, diagnostic imaging like CTs and MRIs, in order for the physician to visualize specific body parts. In PT, as a therapist, we use these with exercise and talk about movement within planes. So I promise they do come in handy. So sagittal plane, and then we've got the frontal plane next. This divides the body into front and back, but in anatomy we say anterior or ventral and posterior or dorsal. Lastly, the transverse plane divides the body into top and bottom, and that means superior and inferior parts or segments. So those are the different planes, and every now and then you will see an oblique plane, and that divides the body at an angle, or body part at an angle. You'll also see these if you use microscope slides, because sometimes they'll tell you the type of section, and that lets you know how it was cut from the specimen to give you the microscope image. Okay, moving right along. Body cavities. The body has cavities that are close to the environment. This is where we find a lot of internal organs. And so there's two main divisions here. The dorsal body cavity that's on the back side, and the ventral body cavity that contains organs that are mainly toward the front or ventral part of the body. So the dorsal cavity includes two subdivisions, the cranial and the vertebral cavities. And let's look at those for a second. We'll go back to the notes in a minute. But the cranial cavity is where the brain is encased. And then the spinal or vertebral cavity is where we find the spinal cord. And those are organs that are mainly toward the posterior side of the body. Those are protected, by the way, by some pretty decent bony structures. The ventral cavity, though, is on the front or anterior aspect of the body and includes the thoracic and abdominopelvic division. All right, so let's go back to the notes for just a second in case you needed that slide. All right, and then we'll keep moving. Pause it if you need to, I promise. Pause and take notes. But let's talk about the ventral cavity for just a second, then I'll show you the notes here. The thoracic and abdominal cavities are separated by the diaphragm. And then if we look at the thoracic division, there's some smaller subdivisions inside, including the two pleural cavities. This is where the lungs are located, and then the pericardial cavity, and that's where the heart is located. It's also within an area known as the mediastinum, and so that's a word that you'll see come up with that thoracic cavity quite a bit. The abdominal and pelvic region are the subdivisions of this division, and that's where we find reproductive, urinary, and digestive organs. So again, the two subdivisions of the ventral cavity are thoracic and abdominopelvic. And if we look at the thoracic cavity, we saw two pleural cavities for the lungs, the mediastinum, which contains the pericardial cavity for the heart, and the abdominopelvic cavity includes these two subdivisions. Now, these ventral cavities are not offered as much protection necessarily by bones, and so they have organs that are covered by what are called serous membranes. These are double-layered membranes, and so that means two layers, and those layers are the parietal and visceral layers. So the viscera means organ, the visceral layer covers or adheres to the surface of the organ itself. And then there's a space filled with some serous fluid, and the superficial layer above that is the parietal layer. Typically, that lines the body cavity wall, and so sometimes it will kind of move with the wall of the body. More to come with that in anatomy too. Now, that space between the layers, again, has a little cavity that's filled with serous fluid that's made by the membrane, and that helps to decrease resistance and friction when the organs are moving, like when the heart beats or when the lungs expand with respiration, and so on and so forth. Okay, now, I always say this is like charades with serous membranes. We've got two serous membrane, sorry, we have really 6 serous membrane layers that we could talk about, and each one of them has 2 names. And so the first part of the name is going to be visceral or parietal. It tells us, is the layer deep or superficial? The second part of the name tells us which organ, which cavity is this associated with. Okay, so the pericardium is going to be associated with the heart. Pleural serous membrane covers the lungs, and a new word, peritoneal serous membrane, covers those organs in the abdominopelvic cavity. So we can kind of add everything together and come up with more specific names, and hopefully you can see. I'm going to try to type on the screen here. All right, so I'll give you an example. The visceral pleura is the name of the specific layer that covers the surface of the lungs. It adheres to or sticks to the surface of the lungs, and we know that it is the deeper layer of the two because it's got that word visceral in there. You could also have a visceral pericardium and a visceral peritoneum. and then there is a parietal pleura, parietal pericardium, parietal peritoneum. Those are the 6 possible combinations for serous membrane layers. All right, so your book has this example to kind of show you the membrane layers and what this looks like. I'm not going to go through the analogy here, but I'm just going through the foundation of it. But read if you want a little bit more info. Now, that fluid inside the cavity between the layers can be overwhelming at times. This can cause some obvious homeostatic imbalance and lead to some painful conditions like pleurisy, which is when there's too much serous fluid in the pleural cavity between the 2 pleural membrane layers, or peritonitis within the peritoneal serous membrane. And that's not a good thing because that makes the layers move irregularly. It could cause more friction, more harm to the organ, and pain as the organs do move. All right, now we can also kind of externally ish divide things up further. So the abdominopelvic area can be divided into both quadrants and regions. And so quadrants are pretty straightforward. Quad means 4, and so there's 2 upper and 2 lower quadrants, and then they are named for left and right. And something to kind of consider with this is, when a patient comes in and they're having pain or signs or symptoms or whatever in one of these quadrants, it can help us to indicate and maybe pinpoint which organ could be involved, possibly. And so we can see in this view that there are some specific organ locations in those quadrants that help us to understand better what might be going on. So we see the stomach, for example, in the left upper quadrant. And we see the appendix, everybody's favorite, in the right lower quadrant. Liver, gallbladder in the right upper quadrant. And small intestines, more of the large intestine, a little bit of the urinary bladder in the left lower quadrant. So this helps us to sort of narrow things down. It could also be used, to describe a location of an external sort of wound or something like that. But we could further divide things up into 9 regions, 9 abdominopelvic regions, and it kind of looks like tic-tac-toe. So with this, we can also consider, maybe more specifically too, which organs could be involved. And so that's very, very small. But this is the list of the regions. I think there's also a blank diagram on Moodle, and there's also a labeling game if you want to take advantage of that. So 2 hypochondriac regions, epigastric, which means on the stomach, 2 lumbar regions, umbilical region, hypogastric, which means under the stomach, and 2 iliac or inguinal regions. Okay, and there's other cavities too. There's other cavities that are smaller and they're exposed to the environment, and those include the pathways for the digestive system, the respiratory system, the eyes, the ears, and so we'll see more of that much later. And other cavities that are not exposed to the environment include synovial cavities. These supply or surround joints that are freely movable. And that includes things like the knee, the elbow, the shoulder. And so those will also come up more in Chapter 8. So hang on for that. Hopefully this was helpful, and email me with any questions.